Mr. Hung was a man of routine. Every morning, he would wake up at the same time, brew a cup of green tea, and take a brisk walk around his neighborhood. He believed these habits were keeping him healthy. At 71, he felt proud of his active lifestyle and often shared his tips with friends. He ate plenty of fruits and vegetables, avoided junk food, and thought he was doing everything right. However, one fateful morning, Mr. Hung's life took a tragic turn. As he was walking, he suddenly felt dizzy and collapsed on the sidewalk. A passerby called for help, and soon he was in the hospital. The doctors discovered that Mr. Hung had high blood pressure, which he had been unaware of. His daily walks, while beneficial, were not enough to counteract the stress. His body was under. He had also been neglecting regular checkups, thinking that his healthy habits were enough to keep him safe. This incident opened Mr. Hung's eyes to the importance of balance and health. While his routines were good, they were not complete. He realized that small adjustments could make a big difference. For instance, he learned that incorporating strength training into his walks could help improve his overall fitness. He also started monitoring his blood pressure regularly and made it a point to visit his doctor for checkups. Mr. Hung began to understand that health is not just about what we do, but also about how we listen to our bodies. He started practicing mindfulness, taking time to relax and reduce stress. He even joined a local community group where he could socialize and share experiences with others, which added joy to his life. Through these changes, Mr. Hung found a new sense of fulfillment. He learned that even small adjustments in daily habits could lead to a healthier and happier life. His story serves as a reminder that, while routines can be beneficial, it is essential to stay aware of our overall health and make necessary changes along the way. Understanding the risks of exercising on an empty stomach is particularly important for seniors. As we age, our bodies undergo various physiological changes that can affect how we respond to physical activity. When seniors skip breakfast and then engage in strenuous activities, they may face serious health consequences, including heart attacks or strokes. In the morning, our bodies are often in a state of low energy after fasting overnight. This means that blood sugar levels can be lower than ideal, which is crucial for providing the energy needed for exercise. When seniors exercise without having eaten, they may not have enough fuel to support their activity. This can lead to dizziness, fatigue, and even fainting. More alarmingly, the stress of strenuous exercise on an empty stomach can put extra strain on the heart, increasing the risk of cardiovascular events. Moreover, skipping breakfast can lead to dehydration, especially if seniors do not drink enough water after waking up. Dehydration can further complicate the situation, as it can affect blood pressure and heart function. When the body is not properly hydrated, it struggles to regulate temperature and maintain adequate blood flow, which can be dangerous during physical exertion. A balanced breakfast is essential for providing the necessary nutrients and energy to start the day. Foods rich in carbohydrates, proteins, and healthy fats can help stabilize blood sugar levels and prepare the body for activity. Additionally, proper hydration is vital. Drinking water in the morning helps to kickstart metabolism and supports overall bodily functions. In summary, for seniors, understanding the risks associated with exercising on an empty stomach is crucial. It is important to prioritize a nutritious breakfast and stay hydrated to ensure that the body is ready for the demands of physical activity. Taking these steps can help prevent serious health issues and promote a healthier, more active lifestyle. Starting the day with gentle morning routines can be a wonderful way to prepare both the body and mind for the hours ahead. Activities like stretching, Tai Chi, or light walking are not only easy to do but also help to ease the body into movement without causing strain. These practices allow the muscles to wake up gradually, promoting flexibility and reducing the risk of injury. When you stretch, for instance, you increase blood flow to your muscles, which can help you feel more alert and ready to take on the day. Tai Chi, often described as meditation in motion, combines slow, deliberate movements with deep breathing. This practice not only enhances physical balance and coordination but also calms the mind. Engaging in Tai Chi can create a sense of peace and focus, making it easier to handle the challenges that may arise throughout the day. Similarly, a light walk, especially in a natural setting, can invigorate the senses and boost mood. The fresh air and gentle movement can clear the mind, allowing for a more positive outlook. These gentle morning activities can significantly improve emotional well-being. When you take time for yourself in the morning, you set a tone of self-care that can carry through the day. This small act of kindness towards yourself can lead to increased feelings of happiness and reduce stress. As you become more aware of your body and breath, you may find that you are better equipped to manage your emotions and respond to situations with a clearer mind. Incorporating these practices into your morning routine doesn't have to be complicated. Even just a few minutes of stretching or a short walk can make a difference. The key is consistency. Small changes in your morning habits can create a ripple effect on your overall health and vitality. Over time, you may notice improved energy levels, better focus, and a greater sense of well-being. By prioritizing these gentle routines, you are not only nurturing your body, but also fostering a positive mindset. This simple act of self-care can transform your mornings and, ultimately, your entire day. Embracing these practices can lead to a more refreshed and energized you, ready to face whatever comes. Getting out of bed too quickly can pose significant dangers, especially for older adults. When a person suddenly stands up, the body may not have enough time to adjust to the change in position. This can lead to a condition known as orthostatic hypotension, where blood pressure drops suddenly upon standing. As a result, the brain may not receive enough blood flow, leading to dizziness or lightheadedness. For older adults, this can be particularly risky, as they may already have compromised balance or strength. The combination of dizziness and instability increases the risk of falls, which can lead to serious injuries such as fractures or head trauma. The physiological effects of sudden movements are quite profound. When you stand up quickly, gravity pulls blood down into your legs, and if your body does not respond quickly enough to maintain blood flow to the brain, you may feel faint. This is why many people experience a brief moment of disorientation or dizziness when they rise too fast. For older adults, whose cardiovascular systems may not respond as efficiently, this can be a frequent and dangerous occurrence. To transition from rest to activity safely, it is essential to adopt a mindful morning routine. Start by taking a moment to stretch gently while still lying in bed. Stretching your arms and legs can help wake up your muscles and prepare your body for movement. After stretching, take a few deep breaths. Inhale slowly through your nose, allowing your abdomen to rise, and then exhale gently through your mouth. This practice not only calms the mind, but also helps increase oxygen flow to your body, making the transition smoother. Once you feel ready, sit up slowly on the edge of the bed. Allow your feet to dangle for a moment, giving your body time to adjust. You can gently move your feet and ankles to promote circulation. After a minute or so, when you feel stable, stand up slowly. Use the bed or a nearby piece of furniture for support if needed. Take a moment to stand still and breathe deeply before taking your first steps. This gradual approach helps your body adapt to the change in position and reduces the risk of dizziness. Incorporating these mindful practices into your morning routine can have long-term benefits for stability and overall well-being. By taking the time to transition slowly, you not only protect yourself from falls but also promote better circulation and flexibility. Over time, this can lead to improved balance and a greater sense of confidence in your movements. A mindful morning routine sets a positive tone for the day, encouraging a more thoughtful approach to daily activities and enhancing your quality of life. Bathroom activities are a natural part of life, but for seniors, they can sometimes lead to overlooked risks, especially when it comes to straining. Straining during bowel movements can cause discomfort and lead to complications like hemorrhoids or constipation. These issues can be particularly troublesome for older adults who may already be dealing with other health challenges. One of the simplest ways to reduce the risk of straining is to pay attention to posture while using the toilet. Sitting in a more natural position can help ease the process. For instance, elevating the feet slightly by using a small stool can create a better angle for the body, making it easier to pass stool without excessive effort. This small adjustment can make a significant difference in comfort and ease. Dietary habits also play a crucial role in maintaining digestive health. Eating a diet rich in fiber is essential for keeping the digestive system running smoothly. Foods like fruits, vegetables, whole grains, and legumes can help prevent constipation by adding bulk to the stool and promoting regular bowel movements. It's also important to stay hydrated. Drinking plenty of water throughout the day helps soften the stool, making it easier to pass. Seniors should aim for at least 8 glasses of water daily, but individual needs may vary. In addition to diet and hydration, regular physical activity is vital for digestive health. Gentle exercises, such as walking or stretching, can stimulate the digestive system and help prevent constipation. Even light activities can encourage movement in the intestines, making it easier to maintain regularity. Mindful bathroom habits can also contribute to overall well-being. Taking the time to relax and not rush the process can help reduce stress and strain. Creating a calm environment in the bathroom, perhaps by using soft lighting or calming scents, can make the experience more pleasant. Listening to the body's signals and responding promptly when the urge to go arises can also prevent the need for straining later. By making these simple adjustments in posture, diet, and lifestyle, seniors can significantly reduce the risks associated with bathroom activities. These changes not only help prevent complications like hemorrhoids and constipation, but also promote a healthier, more comfortable daily routine. Ultimately, being mindful of bathroom habits is an important aspect of maintaining overall health and well-being. Health plays a crucial role in shaping family dynamics and relationships. When individuals prioritize their health, they not only enhance their own well-being, but also create a ripple effect that benefits their loved ones. A healthy person is often more energetic, engaged, and able to participate in family activities, which fosters stronger bonds and creates lasting memories. This active involvement can be especially meaningful for elders, who can share their wisdom and experiences with younger generations, guiding them through life's challenges and joys. When elders are healthy, they can take part in family gatherings, celebrations, and everyday moments, enriching the lives of those around them. They can share stories from their past, teach skills, or simply enjoy the company of their family. These interactions not only strengthen family ties, but also provide a sense of purpose and belonging for the elders themselves. The joy of seeing grandchildren grow, participating in family traditions, and being part of everyday life can be incredibly fulfilling. On the other hand, when health declines, the impact on family life can be profound. Illness can lead to emotional strain, as loved ones may feel helpless or anxious about their family member's condition. The financial burden can also be significant, with medical expenses and caregiving responsibilities often falling on family members. This can create stress and tension within relationships, as everyone navigates the challenges of illness together. The decline in health can limit participation in family activities, leading to feelings of isolation for both the individual and their loved ones. Recognizing health as a collective priority is essential. When families support each other in making healthy choices, whether through cooking nutritious meals, encouraging physical activity, or simply being there for one another, they create an environment that promotes well-being for everyone. This shared commitment to health can strengthen relationships and reduce the emotional and financial burdens that come with illness. In conclusion, prioritizing health is not just about individual well-being. It is about nurturing the connections that bind families together. Healthy individuals can actively contribute to family life, while declining health can challenge those bonds. By understanding the broader impact of health on family and relationships, we can appreciate the importance of making health a shared goal. Teaching younger generations to prioritize health and well-being is a gift that can last a lifetime. When we encourage children to engage in regular exercise, eat balanced meals, and manage stress effectively, we are not just promoting good habits. We are setting a powerful example for them to follow. These actions become part of their daily lives, shaping their understanding of what it means to be healthy and happy. Regular exercise, for instance, is more than just a way to stay fit. It teaches children the importance of movement and how it can boost their mood and energy levels. When they see family members enjoying activities like walking, biking, or playing sports, they learn that being active can be fun. This enjoyment can lead to a lifelong love for physical activity, helping them stay healthy as they grow older. Balanced nutrition is another crucial aspect of well-being. When families come together to prepare and share healthy meals, it creates a sense of community and belonging. Children learn to appreciate the value of nourishing their bodies with fruits, vegetables, whole grains, and proteins. This knowledge can empower them to make better food choices throughout their lives, reducing the risk of health issues and fostering a positive relationship with food. Stress management is equally important. Teaching children how to cope with stress through mindfulness, relaxation techniques, or simply talking about their feelings equips them with tools to handle life's challenges. When they see adults practicing these skills, they understand that it's okay to seek help and take time for self-care. This understanding builds resilience, allowing them to navigate difficulties with confidence and grace. By prioritizing health and well-being, we are not just improving our own lives, we are creating a ripple effect that touches our loved ones. When children grow up in an environment that values health, they are more likely to pass these lessons on to their own families. This cycle of well-being can lead to generations of healthier, happier individuals who know how to care for themselves and each other. Ultimately, viewing health as a lasting gift we give to our loved ones fosters a legacy of resilience and joy. It is a way to show that we care, not just for today, but for the future. By instilling these values in younger generations, we help them build a foundation for a fulfilling life, filled with vitality and happiness. Teaching financial independence and the value of hard work to younger generations is crucial for their development. When young people learn to earn money honestly, they not only gain financial skills, but also build important character traits like resilience and self-reliance. Working for what they have helps them understand the effort that goes into earning money, which can lead to a deeper appreciation for their achievements. This process teaches them that success often comes from perseverance and dedication rather than simply being handed things. Earning money through honest means fosters a sense of pride and accomplishment. When young people face challenges in their work, they learn to overcome obstacles, which builds resilience. This ability to bounce back from setbacks is a valuable life skill that will serve them well in many areas beyond finances. Additionally, when they rely on their own efforts to achieve their goals, they develop self-reliance. This independence empowers them to make choices that align with their values and aspirations rather than depending on others. In contrast, the fleeting advantages of material inheritance can create a false sense of security. While inheriting wealth may provide immediate comfort, it often lacks the lessons that come from hard work and financial literacy. Those who inherit money without understanding how to manage it may struggle to maintain their wealth or make wise financial decisions. On the other hand, individuals who learn about budgeting, saving, and investing are better equipped to handle their finances throughout their lives. They are more likely to make informed choices that lead to long-term stability and success. To instill these values in younger generations, practical approaches can be very effective. Encouraging entrepreneurship is one way to teach young people about earning money. Whether it's starting a small business or offering services in their community, these experiences can provide valuable lessons in responsibility and financial management. Additionally, teaching budgeting skills can help them understand the importance of tracking income and expenses. Simple activities like setting savings goals or planning for a purchase can make financial concepts more relatable and engaging. By focusing on these principles, we can help young people develop a strong foundation for their future. They will not only learn how to manage money, but also appreciate the value of hard work and ethical practices. This combination will serve them well, leading to a more fulfilling and secure life. Health is a vital thread that weaves through the fabric of family life, creating deeper connections and shared experiences that enrich relationships with love and joy. When family members are healthy, they can engage in activities together, share laughter, and create memories that last a lifetime. Whether it's playing in the park, cooking meals together, or simply enjoying a movie night, good health allows families to bond over these moments, fostering a sense of togetherness and happiness. On the other hand, poor health can cast a shadow over family dynamics. When one member struggles with illness, it often creates an emotional toll that ripples through the entire family. Worry and fear can replace joy, and the energy that once fueled shared experiences may shift to caregiving and concern. Family members may feel helpless, anxious, or even resentful as they navigate the challenges that come with illness. This emotional strain can lead to misunderstandings and distance, making it harder for families to connect and support one another. Viewing health as an act of love and responsibility can transform how families approach their well-being. When each member prioritizes their health, they are not only taking care of themselves, but also showing love for their family. This commitment to health can lead to healthier habits, such as cooking nutritious meals together, exercising as a family, or simply encouraging one another to take time for self-care. These actions not only improve individual health, but also strengthen the bonds between family members, creating a nurturing environment where love and joy can flourish. In essence, health is not just about the absence of illness. It is about creating a life filled with shared experiences, laughter, and love. By prioritizing health, families can ensure happier, more fulfilling lives together, where each member feels valued and supported. Embracing health as a collective responsibility can lead to deeper connections and a more vibrant family life, allowing everyone to thrive. Health is more than just the absence of illness. It is the foundation upon which we build our lives and legacies. When we prioritize our well-being, we are not only investing in ourselves but also in the future of our families and communities. Good health allows us to engage fully in life, to create memories, and to nurture relationships that matter most. It empowers us to pursue our passions and to be present for those we love. Imagine the ripple effect of a healthy life. When we take care of ourselves, we set an example for our children and those around us. They learn the importance of well-being, and this knowledge can be passed down through generations. A commitment to health fosters stronger bonds as we share experiences and support one another in our journeys. It creates a legacy of vitality and resilience that can inspire others long after we are gone. Embracing health as a core value means choosing to live with purpose, dignity, and joy. It is a gift we give ourselves and a promise we make to our loved ones. Prioritizing our well-being, we are not only enhancing our own lives, but also enriching the lives of those we care about. Let us remember that every small step we take towards better health is a step towards a brighter future for ourselves and our families. In this way, health becomes a powerful legacy, one that can transform lives and strengthen the bonds that connect us all. Thank you so much for joining us in exploring the important topic of persistent itching in elderly individuals. We've uncovered how this seemingly simple symptom can often be a signal of deeper health issues, and how recognizing these signs early can truly make a difference in improving both lifespan and quality of life. Your engagement in this discussion shows a commitment to understanding and caring for our loved ones, and that's something we should all be proud of. Now that we've wrapped up this crucial segment, let's shift our focus to another equally vital topic. We'll be diving into practical strategies and tips for caregivers and family members on how to support elderly individuals facing these challenges. This next part will not only empower you with knowledge, but also equip you with the tools to make a real impact in their lives. So, stay tuned as we embark on this journey together, filled with insights and actionable advice that can help enhance the well-being of those we care about. Persistent scalp itching in elderly individuals can be a troubling issue that affects their quality of life. There are several common causes for this discomfort, and understanding them can help in finding relief. One of the most frequent reasons for scalp itching is dry skin. As people age, their skin tends to lose moisture, which can lead to dryness and irritation on the scalp. This dryness can be exacerbated by environmental factors, such as cold weather or low humidity, making the itching even more pronounced. Another common cause is dandruff, which is often linked to a condition called seborrheic dermatitis. This condition leads to flaky skin on the scalp and can cause itching and redness. Psoriasis is another skin condition that can affect the scalp, leading to thick, scaly patches that can be itchy and uncomfortable. Eczema, or atopic dermatitis, can also occur on the scalp, causing inflammation and itching. In some cases, persistent scalp itching may be a sign of more serious systemic conditions. For instance, lymphoma, a type of cancer that affects the lymphatic system, can cause itching as a symptom. Similarly, polycythemia vera, a blood disorder that leads to an increase in red blood cells, can also result in itching. These conditions may be accompanied by other symptoms, such as fatigue, swollen lymph nodes, or unexplained weight loss, which should not be ignored. The symptoms of persistent scalp itching can vary. Individuals may develop sores or redness on the scalp due to constant scratching, which can increase the risk of infections. Chronic scratching can also lead to hair loss, as the hair follicles may become damaged over time. This can be distressing for many elderly individuals, as hair loss can affect their self-esteem and overall appearance. It is important to recognize when scalp itching becomes a concern. If the itching is persistent and accompanied by symptoms such as fatigue, swollen lymph nodes, or unexplained weight loss, it is crucial to seek medical attention. These signs may indicate an underlying health issue that needs to be addressed. In summary, persistent scalp itching in elderly individuals can stem from various causes, including dry skin, dandruff, psoriasis, eczema, and even systemic conditions like lymphoma and polycythemia vera. The symptoms can lead to sores, redness, and hair loss, particularly due to chronic scratching. If the itching is severe or associated with concerning symptoms, persistent itching around the eyes in elderly individuals can be quite uncomfortable and may arise from several causes. One common reason is allergies, which can lead to symptoms like redness, swelling, and watery discharge. Allergies can be triggered by pollen, dust, pet dander, or certain foods. Another frequent cause is dry eyes, a condition that becomes more common with age. When the eyes do not produce enough tears, they can become irritated, leading to itching and discomfort. Blepharitis, an inflammation of the eyelids, is another potential cause. This condition can result in crusty eyelids, redness, and swelling, often accompanied by itching. Additionally, systemic conditions like diabetes can affect the eyes, leading to dryness and irritation. Thyroid disorders, particularly Graves' disease, can also cause eye problems, including swelling and changes in vision. Symptoms accompanying persistent itching may include redness, swelling, watery discharge, and even blurred vision. It is important to pay attention to these signs, especially if they appear suddenly or are accompanied by changes in vision, such as floaters or a decrease in clarity. Systemic symptoms like fatigue, weight gain, or weight loss can also indicate a more serious underlying issue. If someone experiences persistent or worsening symptoms, it is crucial to consult a doctor. Early evaluation can help identify the cause and prevent potential complications. Ignoring these symptoms may lead to more significant health problems, so seeking medical advice is always a wise choice. Severe itching in the anal and genital areas can be a common issue for elderly individuals, and it can be caused by various factors. One of the main causes is infections, which can be bacterial, fungal, or viral. For example, yeast infections are common and can lead to intense itching and discomfort. Bacterial infections can also occur, especially if there is a break in the skin. Viral infections, such as herpes, can cause painful sores and itching in these sensitive areas. Other health conditions can contribute to itching as well. Diabetes can lead to dry skin and infections, making itching more likely. Liver disease can cause a buildup of bile salts in the blood, which can also result in itching. Additionally, certain medications may have side effects that include itching, especially if they cause dryness or allergic reactions. When someone experiences severe itching, they may notice other symptoms like redness, swelling, or discharge from the affected area. Pain can also occur, making it difficult to sit or move comfortably. One of the risks associated with severe itching is skin damage from scratching. Continuous scratching can lead to open sores, which can become infected and worsen the situation. It is important to know when to seek medical care. If the itching is accompanied by bleeding, sharp pain, fever, or unusual urinary or bowel symptoms, it is crucial to get help right away. These signs could indicate a more serious condition that needs immediate attention. In summary, severe itching in the anal and genital areas of elderly individuals can arise from infections, chronic health issues, or medication side effects. Recognizing the symptoms and knowing when to seek medical help can lead to better management and relief from discomfort. Generalized itching all over the body can be a frustrating and uncomfortable experience. Itching or pruritus can arise from various causes, and understanding these can help in managing the symptoms effectively. One common cause of widespread itching is dry skin. When the skin loses moisture, it can become rough and flaky, leading to irritation and an urge to scratch. This is especially common in colder months or in people who do not hydrate their skin properly. Allergies can also lead to generalized itching. When the body comes into contact with allergens, such as certain foods, pollen, or pet dander, it can trigger an immune response that results in itching. This may be accompanied by other symptoms like rashes or hives, which can further aggravate the skin. In addition to these, underlying health issues can cause itching. Liver disease is one such condition. When the liver is not functioning properly, it can lead to a buildup of bile salts in the bloodstream, which can cause intense itching. This may also be accompanied by jaundice, a yellowing of the skin and eyes, dark urine, and fatigue. These symptoms indicate that the liver is struggling to process waste effectively. Kidney disease is another potential cause of generalized itching. When the kidneys are not filtering waste from the blood properly, toxins can accumulate, leading to skin irritation and itching. People with kidney issues may also experience fatigue and changes in energy levels, as the body is not able to eliminate waste efficiently. Thyroid disorders, particularly hypothyroidism, can also lead to itching. An underactive thyroid can cause dry skin, which in turn can lead to itching. Symptoms of thyroid issues may include fatigue, weight gain, and changes in energy levels, which can significantly affect a person's quality of life. It is important to seek medical attention if itching persists or is accompanied by other concerning symptoms. Unexplained weight loss, ongoing fatigue, jaundice, or changes in urine color can indicate serious underlying health issues that require prompt evaluation and treatment. Ignoring these symptoms can lead to complications, so it is wise to consult a healthcare professional for a thorough assessment. In summary, generalized itching can stem from various causes, including dry skin, allergies, liver disease, kidney disease, and thyroid disorders. Recognizing the accompanying symptoms can help in identifying the underlying issue, and seeking medical advice is crucial if the itching does not improve or is linked to other systemic symptoms. Persistent itching on the feet can be caused by several conditions, each with its own set of symptoms. One common cause is athlete's foot, a fungal infection that thrives in warm, moist environments. This condition often leads to redness, scaling, and intense itching between the toes and on the soles of the feet. Another cause is dry skin, which can occur due to environmental factors or lack of moisture. When the skin becomes too dry, it can crack and become itchy, sometimes leading to redness and irritation. Diabetic neuropathy is another potential cause of itching. This condition affects the nerves in the feet, leading to numbness, tingling, or burning sensations. People with diabetes may not feel injuries or irritations on their feet, which can lead to further complications. Peripheral arterial disease can also contribute to foot problems. In PAD, blood flow to the feet is reduced, which can cause symptoms like numbness and slow healing skin. The lack of proper circulation can make the skin more susceptible to infections and ulcers. For individuals with diabetes or circulation issues, persistent itching and related symptoms can pose serious risks. The combination of numbness and itching can prevent a person from noticing injuries or infections, which can worsen quickly. If left untreated, these conditions can lead to severe complications, including ulcers or infections that may require medical intervention. It is crucial for those experiencing persistent itching, especially if they have diabetes or circulation problems, to seek medical attention early. This proactive approach can help prevent more serious health issues and ensure proper care for the feet. Recognizing persistent itching in elderly individuals is very important because it can be a sign of underlying health issues. Itching, especially when it lasts for a long time, can indicate problems such as skin conditions, allergies, or even more serious issues like liver or kidney disease. For older adults who may already be dealing with various health challenges, this symptom should not be ignored. Seeking timely medical attention can help identify the cause of the itching and lead to effective treatment, which can greatly improve their quality of life. When elderly loved ones experience persistent itching, it is essential to encourage them to talk to a healthcare provider. Addressing this symptom early can prevent complications that might arise from untreated conditions. By being proactive about their health, we can help ensure they remain comfortable and happy. It's a way to show we care and want the best for them. Let's stay attentive to their needs and support them in seeking the care they deserve. Thank you so much for joining us in that insightful exploration of our main topic. We've uncovered some fascinating connections between our daily habits and our overall health, particularly when it comes to something as routine as urination. Now, as we transition to a new topic, let's take a moment to reflect on how these changes in bathroom routines, especially for those over 60, can be more than just a minor inconvenience. They could actually signal serious health issues. Have you ever wondered how your urination habits could reflect your overall health? In this next segment, we'll dive deeper into 4 specific urination habits that could impact your lifespan. This is not just about understanding the signs. It's about empowering you with actionable tips that can enhance your health and longevity. So, stick around as we uncover these important insights that could make a real difference in your life. You won't want to miss what's coming up next. As men age, changes in urination habits can often signal underlying health issues. Mr. W, a physically active man in his 60s, began to notice some changes in his urination patterns. At first, he experienced feelings of incomplete bladder emptying, which made him feel like he had to go again shortly after using the bathroom. He also found himself waking up multiple times during the night to urinate, the condition known as nocturia. Initially, Mr. W dismissed these symptoms as just a normal part of getting older. He thought that since he was active and healthy, these changes were nothing to worry about. However, as time went on, he realized that these issues were starting to affect his daily life. The frequent trips to the bathroom disrupted his sleep, leaving him feeling tired and drained during the day. This fatigue began to take a toll on his mood, making him irritable and less enthusiastic about activities he once enjoyed. Mr. W's experience is not uncommon. Many men in their 60s may overlook changes in urination, thinking they are just a natural part of aging. However, these changes can indicate health concerns such as prostate issues or bladder problems. For Mr. W, the impact on his quality of life became too significant to ignore. He started to feel frustrated and anxious about his health, prompting him to seek medical advice. Recognizing the importance of addressing these symptoms early can lead to better management of potential health issues. Mr. W's story highlights how something as simple as urination habits can provide important clues about a person's overall health, especially as they age. Mr. W had always been a proud man, valuing his independence and health. However, as he entered his late 60s, he began to notice some changes in his body. At first, he brushed them off as just part of getting older. He found himself needing to urinate more often, especially at night, and sometimes he felt a weak stream. His friends noticed his discomfort and urged him to see a doctor, but he hesitated, thinking it was just a normal part of aging. Eventually, after much encouragement, Mr. W decided to visit his doctor. During the appointment, the doctor explained that he was experiencing symptoms of benign prostatic hyperplasia, or BPH. This condition is common among older men and occurs when the prostate gland enlarges, leading to various urinary issues. Mr. W learned that while BPH is not cancerous, it can still cause significant problems if left untreated. The doctor emphasized the importance of addressing early warning signs, like frequent urination and difficulty starting or stopping the flow. He explained that ignoring these symptoms could lead to more serious complications, such as kidney damage. Mr. W listened intently as the doctor described how the bladder can become overworked and strained, potentially leading to infections or even kidney failure if the blockage continues. Feeling relieved to have an explanation for his symptoms, Mr. W realized that seeking help was the right choice. He understood that taking action early could prevent more severe health issues down the line. With a treatment plan in place, he felt a sense of hope and empowerment, knowing he was taking control of his health. From that day on, Mr. W became an advocate for his own well-being, sharing his experience with friends and encouraging them to pay attention to their bodies. He learned that it's never too late to seek help, and that addressing health concerns early can make a significant difference in quality of life. As people age, their bodies go through many changes, and one area that can be significantly affected is the urinary system. Statistics show that about 50% of men and 30% of women over the age of 60 experience some form of urinary issues. These problems can range from frequent urination and urgency to more serious conditions like benign prostatic hyperplasia in men or bladder dysfunction in both genders. Conditions like BPH can lead to a range of uncomfortable symptoms, including difficulty starting urination, a weak urine stream, and the need to urinate frequently, especially at night. For women, bladder dysfunction can manifest as incontinence or an overactive bladder, which can be equally distressing. These urinary issues can severely impact a person's quality of life. They may lead to embarrassment, anxiety, and social withdrawal, as individuals may avoid activities or situations where they fear they won't have easy access to a bathroom. Moreover, the psychological effects of these conditions can be profound. The fear of having an accident can limit a person's freedom and independence, making them feel less confident in their daily lives. This can lead to a cycle of isolation and depression, further diminishing their overall well-being. However, early intervention can make a significant difference in managing these urinary issues. Seeking help from healthcare professionals can lead to effective treatments that improve symptoms and enhance quality of life. Simple lifestyle changes, medications, or even surgical options can provide relief and help individuals regain control over their urinary health. By addressing these issues early on, older adults can maintain their independence and enjoy a better quality of life. It is essential for both men and women to be aware of these potential problems and to seek help when needed, as timely intervention can lead to better health outcomes and a more fulfilling life. The urinary system can be thought of as a drainage network for the body, much like a system of pipes that helps remove waste and excess fluids. Just as a well-maintained drainage system keeps a house clean and functioning properly, an efficient urinary system reflects good internal health. When everything is working smoothly, the body can effectively filter out toxins and maintain a balance of fluids. Changes in urination habits can serve as important signals about our overall health. For instance, if someone notices they are urinating more frequently than usual, it could indicate that they are drinking more fluids, or, on the other hand, that their body is struggling to retain water, possibly due to dehydration. Conversely, if someone finds they are urinating less often, it might suggest that they are not drinking enough or that their kidneys are not functioning properly. The color of urine is another key indicator. Clear or light yellow urine typically shows that a person is well hydrated, while dark yellow or amber urine can be a sign of dehydration. If the urine appears cloudy or has a strong odor, it may suggest an infection or other health issues that need attention. Sensation during urination is also important. Pain or discomfort can indicate infections or inflammation in the urinary tract, signaling that something is not right within the drainage network. Just as a blockage in a pipe can lead to bigger problems, issues in the urinary system can reflect or lead to more serious health concerns. In summary, the way we urinate can tell us a lot about our health. By paying attention to changes in frequency, color, and sensation, we can gain insights into our hydration levels, potential infections, or even organ dysfunction. Keeping this drainage network in good shape is essential for overall well-being. Holding in urine may seem like a minor issue, but it can lead to serious health problems over time. When you ignore the urge to urinate, you put extra pressure on your bladder. This can cause the bladder muscles to weaken, making it harder to empty completely in the future. One of the most common risks of holding in urine is the development of bladder infections. When urine stays in the bladder for too long, it can create a breeding ground for bacteria, leading to painful infections that can cause symptoms like burning during urination, frequent urges to go, and even fever. Another risk associated with prolonged urine retention is the formation of bladder stones. These stones can develop when minerals in concentrated urine crystallize. They can cause pain, bleeding, and difficulty urinating. In some cases, bladder stones may require medical treatment or even surgery to remove. Perhaps the most serious consequence of holding in urine is the potential for kidney damage. The kidneys filter waste from the blood and produce urine. If the bladder is too full for too long, it can cause urine to back up into the kidneys, leading to a condition called hydronephrosis. This can result in kidney damage and, in severe cases, kidney failure. Listening to your body's signals is crucial for maintaining good bladder health. When you feel the urge to urinate, it is important to respond to that signal rather than ignoring it. Regularly holding in urine can lead to a cycle of problems that can affect your overall health. By paying attention to your body and urinating when you need to, you can help prevent these serious issues and keep your bladder and kidneys healthy. Draining to urinate can lead to several serious health issues for both men and women. For men, this behavior can worsen conditions like benign prostatic hyperplasia, which is an enlargement of the prostate gland. When a man strains to urinate, he puts extra pressure on the bladder and the prostate. This can make the symptoms of BPH worse, leading to more frequent trips to the bathroom, a weak urine stream, or even complete blockage. Over time, this can cause significant discomfort and may require medical intervention. For women, straining to urinate can contribute to pelvic organ prolapse. This condition occurs when the pelvic organs, such as the bladder or uterus, drop from their normal position due to weakened pelvic muscles. Straining increases pressure in the abdomen, which can push these organs down further, leading to more severe prolapse. This can cause symptoms like discomfort, urinary incontinence, and even pain during physical activities. In both men and women, the long-term risks of straining to urinate include bladder dysfunction, which can make it difficult to control urination. This dysfunction can lead to urinary tract infections, as the bladder may not empty completely, allowing bacteria to grow. Frequent use can cause further complications, including kidney infections, which can be serious. Moreover, the constant straining can lead to organ displacement, which may require surgical correction. This not only poses physical risks, but can also affect mental health, as dealing with chronic pain or discomfort can lead to anxiety and depression. It is crucial to seek medical help. If you find yourself straining to urinate regularly, a healthcare professional can provide guidance and treatment options that can help alleviate the problem and prevent further complications. Ignoring the issue and continuing to strain can lead to more severe health problems down the line. Hydration is very important for our overall health. Water makes up a large part of our bodies and is essential for many functions, including digestion, temperature regulation, and waste removal. When we do not drink enough water, our bodies can become dehydrated, leading to several problems. One common issue is concentrated urine. When we are not drinking enough water, our kidneys conserve water, resulting in urine that is darker and more concentrated. This can be a sign that our bodies are not getting the hydration they need. Insufficient water intake can also lead to kidney stones. These stones form when certain substances in the urine become too concentrated and crystallize. Drinking enough water helps to dilute these substances, reducing the risk of stones forming. Additionally, dehydration can increase the likelihood of urinary tract infections. When we are not well hydrated, our bodies may not flush out bacteria effectively, allowing them to grow and cause infections. To stay hydrated, there are several simple strategies we can use. Setting reminders on our phones or using apps can help us remember to drink water throughout the day. Some people find it helpful to infuse their water with fruits or herbs, like lemon or mint, to make it more enjoyable to drink. This can encourage us to consume more water. Another useful tip is to monitor the color of our urine. Light yellow usually indicates good hydration, while darker urine can be a sign that we need to drink more water. By being mindful of our hydration and taking steps to ensure we drink enough water, we can help prevent issues like concentrated urine, kidney stones, and urinary tract infections. Staying hydrated is a simple yet effective way to support our health and well-being.